Okay, well, I'm going to go ahead and get us started. It looks like the logins have slowed down. So while everybody's putting their name, organization, and where they live or where they work in the chat, it's nice to see a lot of familiar names. I will just thank everybody for being with us today. This is the third webinar in a series that is being conducted by the Framework for an Equitable COVID-19 Homelessness Response Team. And today's webinar is going to get into the nuts and bolts of an area that we have been hearing sort of a lot from communities as a challenge, and that's landlord engagement and unit cultivation. My name is Ann Oliva. I am the Vice President for Housing Policy at the Center on Budget and Policy Priorities. And I am joined today, hopefully by Richard Cho, who is the Senior Advisor for Housing and Services from the Department of Housing and Urban Development. He's not on, he's logging on right now, so he will be with us. Bill Pickle, who is the CEO of Brilliant Corners, and our good friend Cynthia Nagendra from the city of San Francisco will all be talking with us today about this particular topic. Next slide, please. We always start out these webinars by letting you all know who the partners are for the Framework for an Equitable COVID-19 Homelessness Response. You've seen a number of us participate in these webinars and in the videos that we normally post with our materials. The Center on Budget and Policy Priorities, the National Alliance to End Homelessness, the National Healthcare for the Homeless Council, the National Low Income Housing Coalition, who is graciously hosting this webinar for us today, the National Innovation Service, the Urban Institute, Matthew Doherty Consulting, and Barb Poppy and Associates. That team is an unprecedented group of folks because we are living in unprecedented times, and we really felt strongly that we could act together to help communities implement a response to the COVID-19 pandemic. Next slide, please. The framework itself, for those of you who don't know, was developed in the early stages of the pandemic and has provided the foundation for the work that we, the team that I just talked about, that we've done together over the last 18 months or so. And it's built on the following strategies. So as you actually go through the framework document itself, and we'll put a link to the framework website up in the chat, but as you go through the framework document itself, these strategies really guided the development of that document. And the first one is that we do all of this work by advancing racial justice and equity. So it uses a racial justice and equity framework in order that really guided the development of the documents that we have up on our website. We always work to address the highest needs first. So we are focused on people who are experiencing homelessness in unsheltered locations and in shelters. But we also have a lot of materials up on our website around homelessness prevention and how to use eviction prevention resources to prevent homelessness for folks who are already in the shelter system or living in unsheltered locations. In order to do this work really effectively, we need to grow the number of partnerships that we have in place, and that includes maybe some non-traditional partners. The most important set of partners from our point of view are people with lived expertise and experience, making sure that folks with lived experience are fully involved in the decision-making process, but also working with other partners that might be non-traditional. Maybe they're community-based organizations working in highly impacted neighborhoods. Maybe there are other types of organizations that we haven't worked with before, but that really could help us have a strategic and equitable response to COVID-19. Of course, we want to get people into housing as quickly as possible. And this is really an urgent situation. Over the last few years, we've seen chronic homelessness increase. We've seen unsheltered homelessness increase. So we are acting both strategically and quickly. So these are the guiding strategies that are reflected in the framework document. Next slide, please. As I mentioned, this is the third webinar in a series. Right now we have 4 topics. We think we're going to actually go to 5 based on what we're hearing from communities as feedback to these webinars. Today's webinar is on effective landlord engagement and unit cultivation strategies. If Kim, if you could, there we are, she already did it. To take a look at the webinars 1 and 2. We have those recordings already posted on our website. And you can also use that same link to sign up for any future webinars. And the next webinar, which we'll have to announce a date on this, will be about aligning services, funding, and resources. And the 5th webinar that we're thinking about is around partnering with people with lived expertise and experience. Love to hear feedback from you all in the chat if you think that that's something that would be really helpful to you in your community. I also want to take a moment to, while we're on this slide, to plug a new document and set of resources that we have posted just this week. The Urban Institute has posted a series of case studies that take a look at what happened in communities over the last year. It's fascinating and really helpful reading for folks. So Kim just put Urban's case studies in the chat. I would encourage everybody to take a look at those. I think that they're really sort of enlightening. Next slide, please. Richard, could you turn on your camera? If not, there's a wonderful picture of your face also up on the screen. And while Richard's turning on his camera, I mentioned earlier that Richard is joining us as a special guest. He's the Senior Advisor for Housing and Services in the Office of the Secretary at HUD. And Richard, first, I want to really thank you for all the support that the department and that you personally have provided to the framework team. And Kim, if you could put in the chat the recent blog that Richard wrote with William Snow that mentions the framework project, that would be great. And so thanks, Richard. It's awesome to see you. And, you know, lately I've been noticing HUD's discussions really turning to rehousing people with ARP and CARES Act money, and also developing supportive and affordable housing with other funding that was provided through ARP. And we all know that partnering with landlords is a really big part of that rehousing strategy. So we are so happy to have you with us today to share some of the department's current priorities and views, and to help our audience understand where the administration is going, sort of before we get into the nuts and bolts of landlord engagement with Bill and Cynthia. So welcome, Richard.
Great, thank you so much, Ann. And boy, you know, certainly the thanks is all mine on behalf of HUD and our secretary to the framework group for the fantastic work you've done, not only recently, but also throughout the course of the pandemic to really provide a really useful framework for how to think strategically about how to respond to the crisis of homelessness. You know, everything from related to the actual health crisis of COVID, but also the focus on using resources strategically to bring people home, which is ultimately the best protection we have for people from this pandemic. Let me say, and I think it's worth pointing out that as this administration's come in, we've introduced a kind of seismic shift in the way that I think communities can respond to homelessness. And I say that not only in terms of the significant resources. I remember, Ann, back in the day when you and I were both in different roles in the federal government, that we fought really hard for hundreds of millions of dollars and didn't always get it. And now we're like talking about billions of dollars. I still catch myself sometimes when I say millions when I mean billions, because it's just unprecedented level of scale. Yeah. But even beyond just money, right? Like we sort of made some significant policy shifts that haven't necessarily been explicitly pointed out, which is to say that while in the past, the onus and kind of the buck stopped with continuums of care as the place that was intended to solve homelessness. And yet we've now given resources to housing authorities in the form of 70,000 vouchers, along with grant dollars that are going to jurisdictions to be able to create more housing. And the sort of basic ideas behind those is that we really need that really critical resource of long-term rental assistance, that can be coordinated with services, and I'll talk about that in a second, to be able to bring many more people into housing as quickly as possible, but also dollars to be able to add to the stock. Because what we've heard is, as much as there has been overwhelming appreciation for the vouchers, it's hard to use vouchers. And I'm really glad there's a focus today on landlord engagement, because real estate, finding rental units in the market right now is really tight and difficult. And so we need a two-pronged strategy of using rental assistance and services to house people in the near term, but also where we need to build more dedicated housing units to serve people experiencing homelessness that can be added to our national inventory. And so between the emergency housing vouchers that we've awarded and the soon-to-be released $5 billion in home ARP funds, communities will have resources that can help them significantly house more people in the near term, as well as add to the stock of affordable and permanent supportive housing in the community. And that's exactly what we hope communities will do. Let me just say this, that I know communities were, we heard, thank you very much for the rental assistance and the capital and grant dollars. Where's the service dollars? And they kind of expected HUD to give a bunch of service dollars out with these funds. And what I want to point out is that there's actually quite a bit of services funding out there. It just came in forms that may not necessarily have had the sort of headline homelessness funding on them, but they're significant resources. $3 billion or so in funds that went through mental health and substance abuse block grants through the American Rescue Plan that specifically called out housing related services. $6 billion that went to community health centers that can fund a variety of flexible resources, including community health workers and housing related case management services. And then also a slightly more complicated one that we will be talking about in a webinar next week, but where states received a 10% increase in Medicaid matching funds from the federal government for home and community-based services, which translates to $12 billion in funds that states will receive. And what happens is, when the feds increase the federal share that states receive, that frees up state dollars. States are then required to use those not for bridges or roads or to stick into the rainy day funds, but must use services that will either directly support home and community-based services or sort of help them to use home and community services. That includes explicitly transitioning people from homelessness into housing. So housing-related case management services is an eligible activity of the state dollars that are freed up from the feds giving a 10% increase. 10% doesn't sound like much, but remember, Medicaid is a huge, like $300 to $500 billion federal program. So 10% is a lot when it comes down. So lots of service opportunities. You'll hear more about that. But again, Ann, I want to just point out the seismic shift. We're engaging new partners, giving them resources to support efforts to end homelessness. We are requiring or encouraging them strongly to partner with continuums of care, and we're doing that through the federal tools that we have, but really the partnerships are really up to what happens at the community level. And we're really focusing on helping provide the resources that can really help communities to not have to do more with less, or be really strategic in trying to use resources to kind of spread out, but the significant kind of resources that we've all long needed to be able to bring our neighbors home.
Thank you so much, Richard. I hope you get to stick around with us. We'll take a live Q&A at the end. But for now, I'm going to go ahead and get us started with the content of this presentation. And I just want to say one more time, thank you so much for your support, for all the work that is happening out there in the field, but the support of the department has been key for communities to be really strategic in the use of these dollars. So thank you so much. Okay, let's go to the next slide. As reflected in the strategies that I talked about at the top of the presentation, I just want to spend a few minutes sort of grounding us in racial justice and equity as an approach. And when we do these presentations, for folks who have already been to a couple of our webinars, these slides will be familiar. We like to start here just to remind everybody about the data and about the potential impact of these programs as we go forward. Next slide, please. So we know that homelessness and housing instability result from racist practices and marginalization of communities and people, including BIPOC people, LGBTQ people, and people living with disabilities, among others. We also know that how we use these funds is really important because it will impact those same communities that I just mentioned. So using a racial justice and equity approach is key to addressing these inequities, which have already been exacerbated by the pandemic. Next slide, please. When we think about how to use and target these funds, we recommend, the team, the framework team recommends looking at a variety of national data. I'm going to show you some examples over the next couple of slides, but also more importantly, your own local disaggregated data. What this shows is that Black renters face higher rates of eviction, and that is especially true for Black women. Next slide, please. Renters of color have faced the greatest hardships during the pandemic, as you can see in this graphic. All of these graphics are up on the Center on Budget and Policy Priorities website, and they are included in the slide decks that we will be posting on our website, the framework's website. Next slide, please. And related to those last two slides, it is not surprising that people of color are more likely to experience homelessness. So again, you need to really be considering your local conditions in addition to this national data in order to tailor your specific approach in your community. And part of your approach should always include involving impacted people in policy development, program design, and asking folks what they need and want out of these programs. Next slide, please. So I just want to remind everybody that we'll be doing a live Q&A at the end. So if you have questions, don't put them in the chat, put them in the Q&A box, and Kim and I will track them. So that's just a reminder, and let's dig into the content today. So in order to have an equitable and strategic approach, you need to have strong partnerships with landlords, and you need to have units available for households who are being served through programs like the emergency housing vouchers or ESGCV. So let's get into how to do that. Bill, I'm going to turn it over to you.
Thank you, Ann. Thank you, Richard. It's really such an honor to be invited to participate today and to talk about these urgent matters, and to do so within the context of an equity framework, which I think for Brilliant Corners, I can say has been organically a part of our focus since our founding in the mid-2000s. So my name is William Pickle. I'm the Chief Executive Officer of Brilliant Corners. I'm incredibly excited to share with you today some of the approaches that we've used to accelerate access to existing housing resources for vulnerable and extremely low-income community members across California. We'll discuss our approach to what you might call scattered site supportive housing, starting with an overview of our flexible housing subsidy pool model, which is a system level design for scaling housing placements. But more importantly, I think we're going to try to unpack some of the best practices from the service delivery model at the heart of the flex pool that you might be able to deploy in your communities where you don't have a flexible housing subsidy pool in order to take full advantage of these long awaited resources such as the emergency housing vouchers and the other resources that are now coming that you heard Richard and Ann speak about. Before diving into some of our content here, it's really an honor for me to introduce my friend and colleague and former Brilliant Corners board member. I hope that doesn't embarrass Cynthia. Cynthia Nagendra, who is currently the Director of Planning and maybe Policy at the San Francisco Department of Homelessness and Supportive Housing. which is at the center of homelessness response in the city and county of San Francisco. Cynthia, do you want to say a couple of words?
Yeah, thank you, Bill. Like Bill, I am very honored to be here and to be participating in this with so many great partners and in conversation with all of you. My name is Cynthia Nagendra, and I am the Director of Policy and Planning for the San Francisco Department of Homelessness and Supportive Housing. I was previously the Director of the Center for Capacity Building at the National Alliance to End Homelessness, where I worked with several communities across the country on designing homeless response systems and programs with the framework partners. And so it feels lovely and very energizing to be in conversation with these national partner colleagues like Ann and Richard and all the other folks who have come together in National Income Housing Coalition, the Alliance, that I so deeply respect and have learned so much from, and am incredibly grateful to for fighting for the resources that we need on the ground and policies we need to do the best work we can do. So thank you to the framework partners for inviting us to participate. I think we're going to have a great conversation today. So as Bill said, Bill is really going to be guiding you through a lot of incredible and I think extremely practical information on the flexible housing subsidy pool model, as he said, but really, drilling down to what it means to work with landlords to be housing very vulnerable people. And particularly in challenging housing markets today, I think that is basically everywhere, that I'm certain will really spur a lot of great conversation, some important questions, and really generate steps to solutions that you can use in your own communities. I know that there's truly significant challenges almost every community faces in housing, and building the capacity in our local systems so that we can have a sustainable systems model, right? So that we're not just kind of responding to and being reactive to everything that kind of comes our way, but we're really trying to build for the future so that we have a response system that truly makes homelessness rare, brief, and one time, and that can scale to meet the increased needs. So I think that's really what's unique here and what's really going to be hopefully come out of our conversation. And I think I'll be asking Bill questions that I think we all have, that many communities have, small, large, not just California communities, bringing in observations of what's happening here on the ground in San Francisco and other California communities that I have worked in or have been doing work with, but also just knowing a lot of communities around the country are struggling with the same things, trying to bring those questions to the forefront. I'll probably be interrupting Bill here and there as I tend to do, which I think Bill knows and is expecting. We know that I just want to say the last things. We know this work is incredibly difficult, and it's easy to talk about this work in a way that makes it sound easy or that we have it all figured out. We do not have it all figured out. And we're working with an ever-tightening housing market, other deeply embedded structural inequities that we're responding to in our homeless response systems and across our systems in all of our communities. So we want to have an honest conversation. We want to talk about the challenges we all have. Please ask hard questions in the Q&A, and we want to hear from you about what's working in your communities, where the challenges are, what you think, how you think this can work or not work, and that'll always help us improve our work as well. So I'll hand it over back to you, Bill, and I'll interrupt you soon.
Thank you. I'm looking forward to that, Cynthia. Those are going to be the high points for sure. Next slide, please. So, before I talk a little bit about Brilliant Corners' founding mission, just to have an understanding of how we patch into the homelessness response system, I also, like Cynthia, want to hit a note of both personal and organizational humility. This work is hard, right? It's really hard to create housing opportunities for people with a range of support needs, people that have extremely low income, fixed income, especially in very tight housing markets, very expensive housing markets. Brilliant Corners as an organization has been incredibly fortunate that we got to iterate some very practical solutions to landlord engagement, securing units, and supporting people once they're in those units. We got to do so without some of the restrictive things that come with so much of our funding, right? And we know what that feels like at Brilliant Corners, but we got to iterate what would it look like if you design something from scratch. And so that's really been part of the story. It's been a collectively iterated model here in California, starting in San Francisco, moving across different human services sectors, and then with the flexible housing subsidy pool in Los Angeles and other locations. And the other thing I just want to say is this work lives outside of me at Brilliant Corners. I've been blessed to have so many fantastic leaders at every level of the organization and incredibly dedicated frontline staff, which I know is common in the nonprofit space, but people with a real relentless problem-solving practical orientation that just keep reapplying themselves to get it done. So I just wanted to start there. So Brilliant Corners is a supportive housing nonprofit organization, and we do work across California to provide innovative housing and housing-related services to individuals transitioning from or at risk of homelessness or institutionalization. If you've heard of Brilliant Corners and you're outside of California, it's probably because of our role in LA County's flexible housing subsidy pool. But in fact, our roots and really the origins of our service delivery model or models are in the disability housing space. Informed by the ADA and the Olmstead decision, we began creating, state-of-the-art residential care homes for formerly institutionalized people, as well as multifamily PSH and scattered site supportive housing programs featuring landlord engagement and person-centered tenancy supports. And that all began partnering with California's Department of Developmental Services and its regional center system. Next slide, please. So this gives you a sense of our impact at a glance. You know, California is the Golden State, and it's also a kind of an apocalyptic nightmare, right? And that's certainly true when you think of the challenges that vulnerable and extremely low-income Californians face, acquiring and maintaining affordable housing of any kind in a state that is home to the majority of the most expensive housing markets in the country. Over the past 15 years, we really embraced that challenge of trying to open up housing resources and scale innovative housing solutions to the level of need. We're nowhere near the level of need, but we are making progress. We started to problem solve, to quote our tagline, wherever housing and services came together. And again, that started in the intellectual and developmental disability space. But we said from the beginning that we were population agnostic. And from there, I think we've been able to demonstrate that the core elements of our approach to housing can work equally well across other sectors serving vulnerable populations, including mental and behavioral health, the reentry space, public health agencies, but also managed care organizations, veterans, transition age youth, and of course, the homelessness response system. Just a couple of the outcomes we've been able to achieve through these approaches. We are closing in on 300 community-based residential care homes, and really we've become one of the go-to partners for the state of California in their historic shift. You heard Richard mention home and community-based services. We really have moved from an institutional model in California to a community-based model of housing and residential supports for people with intellectual and developmental disabilities. And that portfolio, we brought some best practices from the affordable and supportive housing space into that sector. We deed restrict properties in perpetuity for the people who need those types of supports. We also have successfully advocated for the state of California to begin setting aside funds from its developmental services sector to buy into multifamily projects that are in development in the tax credit pipeline. So we're really excited about that. And again, we're going to see new resources through that additional 10% coming from Washington CMS through the home and community-based services process. Then, of course, and this will be a focus today, we co-launched the Los Angeles County Flexible Housing Subsidy Pool in 2014. At peak efficiency, we were facilitating upwards of 200 monthly supportive housing placements every single month, and we achieved almost 10,000 cumulative placements for extremely low-income households since launching. And among the population served included high frequency utilizers of public health services and a range of other populations, including reentry. And last but not least, we're really excited to be able to replicate the LA Flex Pool model with new county-wide or multi-county flex pools in the Inland Empire, San Francisco, as well as San Diego, and similar programs, typically in partnership with managed care organizations in other California communities. Next slide, please. So we like to cut through a lot of the confusion and the debate and the contention in our space by repeating the mantra that housing solves homelessness. Of course, we're not saying that it's easy to find units or to match a vulnerable individual or household to the right home for them. But we are trying to help system partners dispel two really persistent myths. I think the first myth, and the most important one for what we're talking about today, is that we can't house people experiencing homelessness because there simply aren't any housing units available. Since 2008, nobody's called me out on this one. I keep repeating this in public. I don't believe Brilliant Corners has ever failed to house a person, whether that was somebody experiencing homelessness, someone exiting a hospital or another care system, someone coming out of the child welfare system or in the reentry space. We've never failed to house a client because we couldn't find a unit. And that's true in San Francisco, LA, and the other communities that you heard me mention. I think the other myth is that people aren't ready to be housed or don't want to be housed. Our programs and our partnerships demonstrate that there are actually quality units available, even in some of the most expensive, competitive, tight housing markets like San Francisco. And that with the right strategies and resources, it is possible to secure those units in real time for people who have an urgent need. Beyond the industry jargon and the increasingly politicized debates that we see here in California for sure, we see this as a practical problem. How do you find and secure housing resources for community members who simply can't do so on their own, even when they have a voucher? What barriers prevent people from finding and securing and maintaining their own homes? And then critically, what if you had a financial, legal, workflow, administrative, and supportive service solution for every single one of those barriers that prevents people from moving into their own apartment home? That's where Brilliant Corners and I think so many of our peer organizations can come in. We know that vulnerable populations do need customized, person-centered case management, but we believe that on the housing side, there are opportunities for effective standardization of an approach that solves the housing challenge for a broad range of populations and unique individuals. We help communities design those interventions that can successfully overcome the barriers to housing access and retention. And as we like to say, and we may repeat this multiple times during today's webinar, you wouldn't ask a realtor to be your social worker. So why would you expect social workers or case managers to be your real estate expert? So you'll hear about how we've sort of disaggregated those functions at Brilliant Corners. Next slide, please. So what kind of impact have we been able to achieve? This is just looking at the LA County Flexible Housing Subsidy Pool, which really got going late 2014, early 2015. And you can see the trajectory and the cumulative outcomes. Although in today's discussion, we'll focus on some practical things you can do in your communities, I really just want to give a sense of the scale and the sustainability that's possible with the right practical resources and strategies in place. LA County might as well be a nation state, over 10 million residents, nearly 5,000 square miles, 88 cities, a joint powers authority formed by the city and county to run the continuum of care, over 66,000 people experiencing homelessness on any given night. Many people in this space think the number is much higher. 48,000 of those individuals are unsheltered. We have multiples of those figures who are severely rent burdened and living in substandard housing and really at risk of falling into homelessness at any given time. We face in California and in LA the same political squabbles and jurisdictional squabbles that you see around the country over street homelessness and encampments. People are exiting systems every day into transitional housing, really substandard settings and straight into the streets. And we have a notoriously difficult and expensive real estate development landscape. So how have we been able to achieve almost 10,000 people rehoused? Starting in 2014, we began operating the new County Flexible Housing Subsidy Pool in partnership with the County Department of Health Services, and it had a bold new vision and unit called Housing for Health. The Flex Pool, as we call it for short, is really a system-changing innovation that unlocks a range of housing options and ensures housing stability through dedicated landlord engagement, rent subsidy administration, and tenancy supports. So the LA Flex Pool essentially took a model that Brilliant Corners had piloted across a couple of different programs in San Francisco and San Mateo County, a model for securing units for vulnerable people, and reimagined it, not at the level of a boutique program, I'm quoting my friend and colleague Danielle Wildcrest, through which one public agency might be able to rehouse a specific target population, but rather as a platform that could serve a whole range of different populations, maybe with investments across different public and private agencies that support those populations. LA County's Housing for Health Division credits the flexible housing subsidy pool with doubling the number of people they can house annually. In 2017, Rand Corporation found that for every dollar LA invested into the flex pool, the county saved $1.20 in healthcare and other costs. And we think this is one of the largest savings ever documented in the homelessness space. So this slide just shows you that cumulative impact, but I don't want folks to just be dazzled and maybe even turned off by those ginormous LA numbers. I don't want folks to conclude that in some way LA is unique and that the strategies can't be replicated in other communities. The next 5 slides sort of dig into what Ann called the nuts and bolts of the flex pool structure and our service delivery model for getting people rehoused rapidly. And after that, we'll sort of review all of those elements of the flex pool model and talk about how you can adopt or adapt some of those same practical nuts and bolts processes, tools, resources in communities that are facing the challenge and the opportunity of using new housing resources, including vouchers. So
interrupt you for a moment? Thank you. In thinking about, as you're about to enter into talking about the model and especially just sort of looking at the scale of how you've grown, I think one thing that would be helpful for folks to know is that this, and just to think about, which is that this kind of scaling of an organization or of a component of a system requires a lot of infrastructure building, both in that organization and administratively for the people who are funding that. And that also takes some thinking and time. And so when people are looking at these numbers and wondering, we are going to talk about how are these things funded? Where would you, where are you able to sort of get all this flexibility in how you fund things to make the model work? I think it's important just to recognize, I know that, the sort of investments that your organization had to make to really build that infrastructure, even in your internally. And I know many communities, we put a lot on 1 or 2 providers, and then sometimes we're kind of taxing them to the point where they can't do what they need to do. So just something to think about.
That's right. I appreciate that, Cynthia, and we can talk. Hopefully it'll come up in some Q&As as well about the challenges of scaling and the different ways that this can be approached in different communities. We have been part of approaches that have centralized certain functions, and we think that can work. We don't think that's the only way, but we do. I couldn't agree more that I think philanthropy and government really should always be thinking about the capacity of the provider network and take some responsibility for that. Nonprofits are driven by their missions, but can't do it by themselves, and really face chronic challenges around capacity and cash flow and things like that. So here we're looking at a schematic overview of our service delivery model that is at the heart of the flex pools that we operate. And you may be wondering, okay, what is different about this model? Again, I think it's about addressing all or as many of the typical barriers to housing access and retention as possible. So at Brilliant Corners, I do think we tend to think in terms of broad categories of barriers to housing. So first of all, how do you find and secure units? You can see here, we've got a dedicated landlord engagement team. Second, how do you support vulnerable people with the transition into a new home and the initial lease up process and the move in, but then with ongoing tenancy and housing stability? I should also add that how do you keep your promises to the landlord that you made on the front end? Are you still there for them if things go wrong? Third, so there you see that we have a dedicated tenancy supports team to ensure long-term housing stability. Third, how do you support each program participant's overall well-being? At Brilliant Corners, we really wanted to focus on the nuts and bolts of the housing challenge. So we disaggregated tenancy supports and landlord engagement from case management. But we know that the majority of people referred into our flex pool and related programs do need a broader range of supports that we traditionally get from case managers and social workers, right? And lastly, this is not to be minimized. I suspect everybody who's at a nonprofit understands what I'm about to say here. How do you overcome the administrative burdens that come with this work, both within and between agencies in order to achieve housing placements. We know that the most idealistic efforts break down because the referral process grinds to a halt, or people aren't housing ready in terms of paperwork, or a landlord receives the rent payment late or in the wrong amount. There's just a million ways it can go wrong. And all of those are administrative and operational challenges that deserve as much thought and a dedicated team, which Brilliant Corners has, that we call our program operations team, to make sure all those things get as much attention as those other critical, more landlord-facing and client-facing activities. Next slide, please. So this is our staffing structure. And then again, you see that sort of four-part structure. Our staffing structure really reflects the range of focused talent and expertise that we believe is needed or is at least optimal to address each major challenge or barrier to creating housing placements and ensuring housing retention in scattered site supportive housing models. I would say that this four-part division of labor really grew out of an initial aha moment at Brilliant Corners, which was then known as West Bay Housing, back in 2009, I think it was. And we were responding to a request for proposals from the San Francisco Department of Public Health. And the title of that RFP was Scattered Site Supportive Housing and Rent Subsidy Administration. Well, that title told you what the challenge was. And it was a federal settlement, and the city agreed to try to move people out of the hospital system back into the community. They couldn't achieve those goals because they didn't know how to access the available housing units. So that RFP did not say how to do it or what the staffing model would look like. We began to ask ourselves, how could we secure units in San Francisco of all places, competing with the tech sector? That's when we first started to model this quartet of staff roles that are, I think, too often loaded onto the shoulders of a single heroic social worker or case manager. In the early days, I admit that having come to Brilliant Corners from a background in LIHTC and HUD housing development, I really worried. Would funding partners balk at supporting such a diversified array of staffing supports? How many people have to be involved in rehousing one household, for goodness sake? But as we have iterated, replicated, refined, and scaled this approach across the state and across multiple service sectors, I think we've really demonstrated to system partners and to ourselves a kind of proof of concept that this is actually a cost-effective way that's not penny wise and pound foolish to achieve rapid and sustainable housing outcomes for our most vulnerable community members, including people experiencing homelessness. So here you see the staffing structure. We have a housing acquisitions team. They are dedicated to cultivating landlord and developer partnerships. And through those partnerships, they source and legally secure new units and manage a growing portfolio of units, as well as sort of account management, tending to the needs and nurturing the relationship with each property provider. We have a much larger tenancy support team that's client-facing rather than landlord-facing, and they provide initial intake and assessment, unit viewings, help people with the move-in, and then are there to support them and promote housing retention and stability throughout their tenancy. They're also the tenancy support teams, and our key position is housing coordinator. They are a critical liaison between the resident, case manager, property management or landlord, and they're sort of the glue that holds the whole thing together. And then we have a third team at Brilliant Corners, if you can believe it, that is a program operations team. And the aha moment here for Brilliant Corners was that as we began to administer more and more leases and related documents, contractual documents, with this ever-growing portfolio of landlord partnerships and units, and as we began to process upwards of 10 to 15 million in subsidy and client assistance payments every single month, we knew that we couldn't carve that out of our 10 or 15% administrative overhead line item in our government contracts. That in fact, this was not corporate overhead. This was program administration or program operations, and that we needed to staff it up with people trained in managing these complex workflows all the way through to back-end compliance and reporting, and really supporting our tenant and landlord facing teams. And then last but not least, the fourth critical part of our staffing model that we see close to universally across our flex pool and related programs is intensive case management services. This is something that I think our systems and existing agencies do very, very well with focus on specific populations. For example, we've got case management partners that are focused on the reentry population or on veterans experiencing chronic homelessness. In most cases, Brilliant Corners is not providing intensive case management services with Brilliant Corners personnel. Rather, we're partnering with existing community providers who operate under separate contracts with the same government agencies that are funding us. We can also provide case management services, but we also think this is a fantastic opportunity to mix and match with some centralizing and standardization of landlord engagement so that you don't have as much chaos with every service provider calling the same landlords, but also to leverage the power of this, the distributed power of the existing provider network, where they're really great at the person-centered and person-facing services. Okay, I think next slide, please. So how it works, this is a truly schematic. Housing placements happen in real time. So process design is another critical area to lean into that can really make a huge difference in the pace of housing outcomes as well as voucher utilization. These are big picture steps shown here, and of course they hide a much more granular workflow. But before we dive into some of the details of the housing acquisitions and placement phases, I think it's worth noting one key difference between the Brilliant Corners approach and the way many other programs work. We begin to recruit landlord partners and to legally secure control of housing units, or as we say, take down units, in advance of and independently of starting the search for a specific program participant. In other words, and that's why we tend to talk about landlord engagement and housing acquisitions and portfolio management rather than talking about housing navigation. So many times that we hear the term housing navigation, it's navigation to TBD. Where is that unit? And to have somebody who's living in a shelter or on the streets or in a hospital bed, navigate to a place that's unknown, I just think is a recipe for failure and a lot of pain. So we pool units, we legally control them, they are available. And the other part of this is, just as people on the streets or in a shelter aren't in the best place to be navigated to a future home that hasn't been identified and secured yet, at the same time, landlords are not in the habit of holding units. While a nonprofit, it's all the paperwork and approvals and unit inspections and resources in place so that somebody can actually sign a lease and begin paying, and including those upfront costs like first and last month and security deposit, right? So having a pool of units that we build in advance is really critical, driven by both client need and a customer service take on landlord motivations. Brilliant Corners deploys a variety of financial, legal, and customer service resources to secure that portfolio of units in advance of matching individual program participants to a unit that will work for them. We pay for vacant units, we hold them. I'll air some dirty laundry here. Sometimes we're paying for more months of vacant unit than anybody would really want to in a perfect world. But sometimes that's just the ebb and flow of referrals. We think it's still a wise investment to hold a unit for a month, 2 months, even sometimes 3 months, rather than lose that unit and start looking all over again while people are actually homeless. We're able to identify units that we know meet the general criteria, right? We don't necessarily need to know every single need and preference of a particular program participant in order to begin assembling a pool of units that will work for most people. And we'll talk a little bit more later about how people have choice and get to pick a unit that does work for them in our model. In order to secure a pool of units, we work closely with our county and philanthropic partners to set aside a budgeted line item specifically for unit holds. I hope it's the case that some of you out there have this already. If you're on the government side, that you're doing this. If you're on the provider side, that you're negotiating for it. But it's really worth focusing on and having a conversation if you don't have it. We're not guessing and we're not doing a bake sale to try to get the money to hold the vacant units. It's in our budgets. And then we can enter into a time-limited agreement. We have a customized legal tool that we use, that we developed with our attorneys, that we know works. that takes a unit offline. It's got an ugly name. It's called an ARVU, Agreement to Rent a Vacant Unit. And it gives the landlord confidence that at some point there will be somebody moving into that unit, but they also get their bills paid in the meantime, and they're not itching to rent that unit at somebody from Twitter. Okay, let's see. The units we source are geared toward client needs and preferences on the front end, so we can really expedite the matching process when that moment comes. We use two policies, and these have evolved over the years and depending on different program design, but two policies to help expedite the move-in process while also maintaining the spirit of client choice. Number one, we show each client up to 3 units that are held in our pool. And clients also have the freedom to find their own unit. Sometimes case management agencies can find a unit, and we're happy to follow up and close that deal with and for them. And then secondly, once a client has seen a unit, you all know what it's like. Sometimes you're not sure. Do I want that apartment? People need a moment. Well, we already have the unit controlled. We don't want to hold it for months while somebody makes a decision, but we can hold it for a period of time while a person makes a decision amongst the, let's say, 3 units that they've seen. And we'll reserve it until they make their decision whether they want to go forward with an application. So those are a couple of the policies that we use to honor client choice. I think next slide, please. Okay, so understanding landlord motivation really is, a part of that early aha moment that we had at Brilliant Corners. How are we going to help the city and county of San Francisco help people move out of Laguna Honda Hospital and City General back into the community in what was at the time still a hot housing market even then. And we knew that we would have to understand what would motivate landlords to work with us. So most nonprofits working in the rehousing space, I think, are appropriately driven by client-centered values, and Brilliant Corners is no different. We picked up the lingo from the developmental services sector, person-centered, and we say that to this day. And that's essential. But it isn't necessarily the right mindset for opening up competitive private market housing resources. The reality is landlords are worried about their cash flow. They want to maximize it. They want to minimize vacancy loss, and they want to have stable, worry-free communities. So in the worst case scenarios, if you have the same social worker responsible for cultivating and maintaining landlord relationships and advocating for the rights and needs of their client, that person is in a no-win situation, and it can become adversarial through nobody's fault, but it's just baked in, right? So at Brilliant Corners, we really cultivate durable landlord partnerships, and we bring a customer service and account management mindset to our housing partners that really starts with understanding landlord motivation. We take a high-touch customer service approach to our property provider cultivation and retention through key account management. Does it work? Well, 80% of our repeat business, AKA new units that we secure for the first time, is generated from just 20% of our landlord partners that we identify as key accounts. And we've seen this in multiple communities. I'll say something else. In this model, instead of tensions arising between the landlord and the tenant or the landlord and the social worker, we manage through those tensions between our landlord engagement team and our tenancy supports team. They're sometimes battling it out. Is this the right unit? Should we even take units in this building? Maybe this landlord is not the greatest person. We're working through that internally so that it doesn't impact our ability to secure units, our landlord relationships, and most importantly, the well-being and housing stability of our clients. Let's see. Next slide, please. So this, I won't go into everything on this slide. You can see it's kind of small font. This is our housing acquisitions model. These are standard financial, and I would also say legal tools. So, we've touched on the value of a practical approach to each and every housing access barrier, and a staffing model that includes staff dedicated to landlord engagement, unit acquisitions, key account and portfolio management, et cetera, et cetera. The intention and the mindset only go so far. Our landlord-facing teams are able to follow through on their promises to landlords because we negotiate with our funders for a set of critical financial and legal resources, as well as streamlined processes. So you see here, and I've spoken, that we're able to hold units. We have the money to do that. We have a customized tool to do it, a unit holding agreement. We're able to streamline inspections, not easy, particularly when you're working with federal vouchers. Each housing authority approaches this differently, but we try to streamline the inspections process and make it as pain-free as possible for everyone involved, including the landlord. Move-in payments, move-in assistance, property provider incentives. In certain markets, we are paying signing bonuses. Sometimes we'll split that into 2 bonuses. We will iterate. How do you do it? We have to have line item budgets that have the flexibility for us to do this work. Flexible financial assistance, and of course, rent subsidy administration. And maybe I should just pause and say, rent subsidy administration, we are processing a lot of local rent subsidies and the entire rent roll in places like LA County. We are also working with federal rent subsidies where there's ancillary functions and ancillary flexible dollars built around them. So we still have a function there, but we might not be advancing the rent per se. Okay. Let's see. I think we can go to the next slide. So we focused so far really on the front end: landlord engagement, building a unit portfolio, a customer service mindset toward landlords, dedicated staffing. Really, the other core to our model is tenancy supports. We often talk about it in terms of housing retention services. Our language really has shifted a few times over the years, but it's always really the same thing. And we have well over 100 housing coordinators working around the state who are client facing. And as I said, they're kind of the glue. You might assume that this is only client facing, but the reason I wanted to emphasize this here is that it's also the key to our ability to follow through on the front end promises that our landlord engagement specialists, our housing acquisition teams, make to landlords. I mean, if we go in there and give them, and I'm really good at this myself, over promising and under delivering, but if our landlord engagement teams did that, we would be out of business, and worse yet, our clients would be displaced, right? We have to be able to follow through. If we say, don't worry, this is going to be better than your last go around with Section 8. Don't worry, this is going to be better than the last time you agreed to work with a nonprofit to hold some units. We have to be able to deliver. And it's not just the landlord engagement teams, which are very small, that do that. It's also the housing retention folks, the housing coordinators who are there to follow through proactively before something gets so sticky that we're in a relocation or eviction situation. I would say that our housing coordinator support program participants in understanding their rights and responsibilities as tenants, and really unlike case managers, they have the time, even at caseloads that are often 50 to 75 people per housing coordinator, they have the time to focus exclusively on housing matters. They're available throughout the lease to problem solve, to expedite communication amongst landlord and property manager, tenant and case manager through regular phone and in-home visits. So with that, and boy, I feel like I'm talking a lot. With that overview of the flexible housing subsidy pool structure and of our scattered site housing service delivery model, including unit acquisitions, rent subsidy administration, and ongoing tenancy supports, we can turn to how communities that don't have a flex pool can prioritize strategies and resources for successfully scaling landlord engagement, housing acquisition, placements, and voucher utilization. So I'll pause there, maybe a question.
Thanks, Bill. I do have some questions before. There's some questions that have come through the chat, also the Q&A, but also I just thought it would be good to pause here before we talk about how this can work in people's communities. I know people have a lot of specific questions that we're going to get to, but I'll ask a few as well. But you know, knowing that Brilliant Corners is doing this in a number of different markets in California in particular, I thought it would be good for us to kind of talk about the differences in communities, really about how to get started, what it looks like, because this is a model that can adapt to different communities, different markets, and also just kind of emphasize that you can kind of start from where you are, whatever kind of community you are, because I have seen this, and actually I've seen the flexible housing subsidy pool model, or this type of housing search, navigation, retention model work in small communities, small rural mid-sized communities, and that because we're sort of taking the kind of key components and figuring out how to fund them. And you might not be starting with a flexible subsidy pool of resources. You might be really just deploying or centralizing these functions and building that capacity in your system. And I just want to say in San Francisco, as you know, it's been sort of starting in fits and starts over the last few years, but we're kind of really starting to get going because we've put more funding into the subsidy pool. But for years we really haven't had a big investment in scattered site housing. It's been very much site-based permanent supportive housing and not that many other housing options, some rapid rehousing. And so we launching the model here in the last couple of years, really trying to bring the private market into the supportive housing fold, I think we can see a lot of the impacts that it's having. We're creating operational efficiencies, economies of scale, and really importantly, it's not about the size of the program. So we started with fairly small amount of funding here. You can still work towards creating scale. And I just want to point out that the benefits that we're seeing is that having this pool of units available means that we can really start from a place of, and I want to say that when we look at data from here and from other communities across the country, not in San Francisco, when I've done my previous work, is one thing we see is people enrolling in programs, rapid rehousing, permanent sort of housing, and if it's scattered site, it taking a long time between program enrollment and housing placement, if that even happens, right? So shortening the length of time that people are homeless, which is that period of time even between program enrollment and housing placement, is a big benefit to having this pipeline of units. And also that we are able to have units that are really more individualized for the client. So we have options. We have sort of units where people often don't want to leave their communities or their neighborhoods. This is where their childcare is, or where their faith community is, or where their community supports are. And so people want to maybe want to stay in those communities, and we can sort of diversify the housing pool model by doing this kind of more scattered site model. And again, having options. It also helps diversify the providers that are able to participate, right? So providers that want to house folks, but maybe don't have this sort of housing function in that capacity in their particular program and want to house their clients. This is a way to partner with those folks to have clients who maybe households who are underserved, people in underserved, marginalized communities. It's kind of a way, if you're really intentional, to connect those pieces so that we're being really diverse in even who we're housing and where we're housing people, and really kind of targeting as deeply and intentionally and equitably as possible. And I'm just curious what you've seen in different communities as well, across your experience in Brilliant Corners.
Thanks, Cynthia. I appreciate the question and also those reflections. I mean, one thing that we've seen is, just like we said, well, okay, we're sort of population agnostic. We think the same set of strategies can work, for a range of different types of households and individuals. At the same time, we've seen it work in a lot of different housing markets. I think, if anything, small or even rural housing markets, while not without their own challenges, for example, geographic spread can be challenging, right? Travel distances. There are opportunities that aren't available in a place like LA, as enormous as it is, with such enormous numbers of unhoused and unsheltered people, right? So there can be actually real opportunities to implement some of these strategies in smaller communities. But generally speaking, we've seen it work everywhere, regardless of the housing stock, regardless of the moment in time in the housing market. It can be harder, or even harder, depending on housing market conditions, but it does work. Sometimes we will say we think there are 5 units for every person experiencing homelessness in any community. We do not have, a white paper to back that up, but that's just a back of the envelope estimate. It's about accessing and seizing those units while they're available, and striking. I do think, I'm not sure how this speaks to the question. I hope it does. One challenge that I've seen, Cynthia, or that we've seen, is electeds and government agency decision makers just don't recognize scattered site supportive housing as an option. Literally, it's not on the table. I've been in rooms with the smartest people in housing in California where, they're talking about real estate development. They're talking about we need to grow the pipeline of tax credit projects. And, someone from the mayor's office is saying, well, I have an immediate need. I'm going to stand up, 20 or 30 new shelters. And there's nothing in between. Or if there is anything in between and it's scattered site, it's rapid rehousing. And Brilliant Corners, we do some rapid rehousing. Our bread and butter is really think of it as permanent supportive housing in a scattered site model, or at least indefinite term. We're serving folks with a level of vulnerability and pretty much fixed, extremely low incomes that we don't think there's a great fit there for many of those folks in terms of like, okay, it's 24 months, your subsidy goes away, your supports go away. We are modeling some things and we have open mind about it, but it's mostly from our point of view, an indefinite term or permanent scattered site supportive housing model. So I think one of the challenges is just socializing that concept that there's a third way, there's something in between, that's something different than shelter and waiting 10 years for us to catch up through our development pipeline with the unmet need that's generational. I think, let's see, something else that I would say is, it's not that difficult for a single government agency to wrap their minds around the core elements, the funding, the staffing model, holding vacant units, getting them in advance of matching a program participant. You can get one agency to buy into this model. I'm not saying that's easy, but that can be done. To take it to the system level where multiple agencies, maybe multiple jurisdictions, maybe managed care organizations, the reentry system, other systems are investing in the same set of resources, the same strategies, the same outcomes. That is hard. Even where we have flex pools, even in LA, it's not as if it's fully optimized, right? There are lots and lots of programs, lots and lots of providers out there scrambling and competing for the same units, differentially resourced, serving different parts of the overall population that needs this type of intervention. Even in LA, I wouldn't say it's optimized. That is really hard. That takes community discussions. I think philanthropy can play a key role in convening those types of discussions, but that would take time. I think the other thing I would say about San Francisco is an interesting story from the Brilliant Corners lens, Cynthia, because we piloted this whole thing in San Francisco, working with Department of Public Health and Golden Gate Regional Center, and then with the VA. So we've done it with 3 different populations, and those were all classic siloed boutique programs. We had our teams sitting right next to each other, working under different contracts. They still are working under different contracts, differentially resourced, but we were able to iterate this model, the staffing model, the pass-through costs for client assistance, the ability to keep promises to landlords through those programs. So where we're at now, in my view, is taking lessons that we've learned both from those more classic one-off programs serving a specific narrowly defined population in San Francisco, learning what it would look like to scale that in places like LA and bringing that back to San Francisco. And by the way, just for folks that are thinking about, the existing provider network versus standing up some sort of centralized landlord engagement group, in San Francisco, Brilliant Corners is one of 3 nonprofits that are working to source units across the flex pool. So we've got 2 other great agencies with stellar track records of supporting people and creating housing opportunities in the existing private market. And we're all working together, but there's a standardization of approach that I think is really beneficial.
Thanks. And I'm just going to ask a couple questions here. I know we're short on time and we have some more content to get through, but just want to get to some of the audience questions. And I think a bunch of folks have questions about the unit holding. Who pays for it? I know we're going to get a little bit to the funding, but who pays for it? And then what's the sort of legal hold? Is it you as an organization is paying for that? And then, what's the relationship to the landlord during the holding time? And then is it that eventually the client then does ultimately rent from the landlord? It's not like they're renting from you, they're renting from the landlord.
It's funny you should ask that, Cynthia, because I think you have an invoice in your inbox that will reimburse us for those unit holds. You knew I was going to say that. It's a great question. And we changed it up over the years. When we started doing this in San Francisco, we did corporate leasing and subleasing to our clients. And we didn't think there was any other way to do it. When we went to LA and we knew we were going to go at scale, frankly, I just was experiencing a lot of pain at Brilliant Corners, being in this nebulous legal space where we are both a landlord and a tenant. It's just a very fraught structure. So we had another one of those aha moments and said, well, wait a minute, why don't we just do what housing authorities do? So we came up with a structure that's very similar to a housing authority contract with a landlord. And it spells out roles and responsibilities, the conditions on which they'll give us a unit, what happens on the back end. But it also has another benefit, right? Not only does it keep Brilliant Corners out of this gray area where we're both a landlord and a tenant, but it gives people their own lease and tenant rights, and really maybe even more important than rights, the pride of ownership in a sense, right? I'm a tenant, I hold the lease, I'm establishing my track record as a good tenant, okay? And so that's what we're doing most of the time. In terms of paying for things, Brilliant Corners is most often paying, in some of our programs, we're paying 100% of the rent and then collecting in arrears from a client portion. That can be really challenging in a scattered site model, so I don't recommend it. There are risks in the other approach, right? What is the risk if Brilliant Corners only pays the rent subsidy portion, which we do when we're using local subsidies as opposed to federal subsidies? Then you're asking the property manager or landlord to collect the tenant portion. And that's a place where things can go wrong. But surprisingly, I don't think we have major problems there because our housing coordinators are working with tenants to make sure that they understand their obligations under the lease.
So I know we don't have a ton of time. We have a lot of questions coming in. So Bill, I'm going to ask you, do you want to, if you want to get through some more content or answer questions, it's up to you.
I think maybe we should hold questions a little bit to the end just because, I was a little bit nervous about this coming in. We've really talked about the model and the core elements of the model, but now it's really getting down to the most important part of the presentation, which is how might folks, whether you're in government, whether you're in philanthropy, whether you're a provider, how might you take some of these ideas and apply them even when you've got really urgent work to do with vouchers hitting the street? So I'd love to move on to that.
Sure.
So we could go to the next slide, please. Okay, so how can this work in your community? It's not going to be easy, but we'll share some best practices and tips for how you can do it. And I wanted to start by just saying, try to build out to the extent possible a holistic approach. That an approach that incorporates feedback from all the parties involved. What am I talking about here? If you're at a government agency and you're right now trying to figure out, well, what's our best approach to getting these vouchers on the streets and getting people housed and meeting really scary, voucher utilization deadlines from DC or the housing authority, you need to be listening to your provider network, right? To understand what they're going to need to help you achieve those goals. So I know you don't have time to plan. You've got hot money that's going to hit the street and the voucher utilization deadlines are on the horizon. It's the story of our sector. Plus, we're trying to rehouse people experiencing homelessness, right? And every minute counts. It really is a sort of an urgent triage situation. You need to start implementing maybe weeks or months before you feel like you even have a signed contract and budgets and clear workflows and referral pathways and all the agency roles and interagency coordination. It's all nailed. And not only that, you've staffed up and you've trained your new employees. Okay, right. But even though you're feeling all those urgencies wherever you sit in our systems, it's still the right moment to apply what a consultant recently told me, go slow to go fast. It's never too late to start these conversations, even if you are kind of going live. Maybe see if you can have convenings of key stakeholders. It's probably going to require more than one convening. Perhaps you need convenings that are at a strategic as well as at a tactical and implementation level. Even if it happens more or less simultaneously while you're going live, I think it's really critical to shared understanding and maintaining that shared understanding and sort of continuous improvement. Maybe you have an opportunity to correct for some of the likely challenges before you are in mid-project and facing an impending voucher utilization deadline and everybody's upset and there's bad stories in the newspaper. If humanly possible, dedicate adequate time for kind of a process design and ramp up period before you go live. I know in many cases that simply isn't possible. It's just better to design and align around eligibility and referrals and contract and payment terms in advance if you possibly can. I would suggest thinking hard about what activities can, might, should be centralized, and about what activities can, might, should be standardized, even if not centralized. So much of what Brilliant Corners does is to centralize and standardize housing acquisition, landlord partnerships, rent subsidies, and related administrative efforts, and of course, tenancy supports. Whether you approach this through centralizing with maybe an increasingly strong partner around the landlord engagement space and the subsidy space, or whether you just standardize with multiple agencies doing that function, it really can be a huge win to minimize, number one, mixed messaging to private market landlords, right? Hearing different things from different parts of the system, from different providers. And it also just can reduce administrative complexity and burden on both the government and the nonprofit side. And I think this levels the playing field for folks normally facing a huge variety of resources and roles across housing access programs, serving maybe a dozen or more target populations in a given community. One other note here is, I've said earlier in the presentation that where things can get customized for specific populations and even down to the individual program participant, maybe is more in the case management space. In LA County, I think it was a really good move that they made to create some level of standardization for case management services as well. So for Brilliant Corners, we know in our role around landlord engagement and tenancy supports that every one of our program participants in the LA Flex Pool has intensive case management services. And the service providers have a standardized contract with a couple of different acuity rates and payment tiers, and they can build around that. Okay, so let's see. I don't know if we want to have more questions here, Cynthia?
Yeah, we have about 7 or 8 minutes left in our time. So I think that it might be, if you want to get to maybe your funding slide, or we can end with questions.
Let's try to power through these. Apologies that we're a little over time. Let's go to the next slide, please. Okay, I'm going to be really brief on this one because a little bit duplicative. Building and nurturing meaningful stakeholder relationships. If there's any sort of existing tensions, as there are in most of our systems, right? Oh, the housing authority doesn't get it, or this provider doesn't get it. Try to understand where that other agency and the individuals there are coming from, the types of often enormous restrictions and constraints, whether regulatory or financial or process, that they're facing, and just build those relationships both at the organizational and at the personal level. Critically, I think, engage with your local government to find those gap funding sources. If you have a funding source that simply won't pay for some of the critical bells and whistles that I've talked about, have those conversations. Where could you get them? Is philanthropy available? Might a health plan come through? Does the government agency you're working with have a different pot of money that's more flexible that they can mix together with your primary funding source? And then continuing on the funding theme, if we could advance to the next slide, really try to identify, oops, I went too far. Really try to identify all funding needs. Create a line item budget, even if you don't know how you're going to get all those line items funded, for every client assistance and landlord incentive fund that could block or delay securing housing units and making housing placements. Make sure you've identified all of the one-time funds you need before the move-in process is going, right? All types of client assistance funds. Most of you know, security deposits, possibly first and last month, utility setup, sometimes furnishings, right? Sometimes landlord bonuses. Centralize the framework for client-related costs, right? Create an overall framework approach to funding needs, so it's not done on a person-by-person, case-by-case basis. That way, your nonprofit providers know that those resources are there. They may not draw every one of those sources down for every client, and then you can reallocate those funds, right? But having them there empowers your providers. They know they have those tools available if that's what's necessary to take down a unit or move somebody in. Let's see, I think maybe let's see the next slide. Oh, well, this one is dear to my heart as a nonprofit CEO, and I don't think it can be minimized. We talk a lot at Brilliant Corners about procurement reform. The way in which the nonprofit community is supported by government, philanthropy, it's a really tough business model, right? You're often paid in arrears. Sometimes you have 10 contracts to do very similar things. If you can get some contract streamlining, that can be super helpful. In LA, we were blessed with a 15-year contract, and we knew the first 4 years what our placement goals were, right? So that's extraordinary, hard to replicate. Try to move toward that. Also, maybe consider talking about an advanced structure, especially if you're going to get involved as a provider in fronting the funds, right? For client assistance or signing bonuses or even rent subsidies where you're not using a federal source. Most nonprofit providers just don't have the financial bandwidth to do that. So begin talking about whether there could be a unique advanced structure in place. In LA County, we have a rolling advanced structure that is replenished monthly and resized as needed, usually annually, as the program grows. So we're not taking ourselves into a deficit position and impinging on our own cash flow in order to keep our focus on placing people. Let's see, next slide.
Can I just quickly say that we can run a little bit over, even if folks need to drop off. This is being recorded, and this is really important information. We're getting a ton of questions. So if you all have time, we're happy to run over a few minutes, if that's okay.
Great.
Awesome. Great.
Thank you, and that's super helpful. And I still feel a little rushed, but you know, another key point, as I hope has become apparent throughout the webinar, develop a robust staffing model. We didn't talk a lot today about equity, which really is the framework in which we're having this discussion, right? But this is one place where I think the equity conversations need to come into play. We ask our nonprofit staff to do extraordinary things. And not only do they have to have incredible talent and perseverance and skill, they also carry a heavy emotional burden. I think they can experience not only burnout, but genuine trauma working in this space. And we make all of those things worse when we as nonprofit leaders, or we as government funders, or even philanthropy, ask nonprofits to do more with less. There's got to be, you know, we talk a lot at Brilliant Corners about the scarcity mindset and the abundance mindset and all these little things that you talk about at a cocktail party. I think where the rubber hits the road is with us. It's not just in DC, it's not in some faraway place. How do we overcome that urge we have to say, but I don't have enough money, and we have to tighten the pencil, we have to do, you know, sharpen the pencil and do more with less. I think we really have to start with a clear sense of what we need, both for those pass-through costs to get people into units, also for our staffing model, so that we don't ask too few people to do too much. Next slide, please. Oh, just reiterating, create a pool of units. Find a way, start those conversations in your community so that you can have units available in advance. If you're in a position where you're being charged to go find a unit and the client has already been referred and they're sort of already housing ready, but they're in a terrible place, right? They're on the streets, they're in a shelter. Maybe you know, you can lose track of them even, right? Start having those conversations about how you can create a mechanism to pull units in advance and then show units to clients and give them some choice. Next slide, please. Landlord engagement and retention strategies. Engage with local landlords and property owners now to see if they have units coming online soon. Really create an approach that allows you to maintain and nurture positive relationships with your landlords even after the client move in. I mean, it's just human nature, right? We get the unit and we're on to the next thing. Make sure you have the capacity and some guidelines internally to follow through. You know, cultivate that relationship, even when there's no problem, right? That you have staff capacity to reach out and nurture those relationships. You might consider holding an event for prospective and current landlords that you work with, especially when you're at the moment of a surge, right? When new resources are coming in and you're going to have to get landlords engaged and interested. Those are opportunities to bring landlords that you've already worked with that have a positive experience in the program and have them speak to other landlords and sell them on the program. Try to create a one-pager or some other decent marketing material to explain to landlords the benefits of working with your program, with vouchers. Be aware that many of them will have experienced pain points working with nonprofits or housing authorities in the past. And then work closely with all parties involved in a client's case to ensure a smooth moving process for everybody, including the landlord and property manager. Next slide, please. Oh, we kind of made it to the end. We blitzed through those last few. But you know, just a couple of key takeaways. It's really these elements. I worry a lot openly that Brilliant Corners has become another nonprofit that you know, we're a hammer and we see everything as a nail, right? And we're really zealous about fidelity to our model. but I can't overstress how many times we've been asked, for example, by housing authorities, can you just come in and help us secure units and then go away? And we've always said no. We think that these elements are only as good as the weakest link in the chain, and they need to all be there together. The front end housing locator services, the ongoing tenancy supports, the wraparound case management if you're serving vulnerable populations, and really the administrative capacity for all of those back end activities that I talked about in our program ops model. To us, if any one of those elements is taken away, we're not sure that this works. So maybe with that, I don't know if is there one more slide? I think there's just thank you slide. Thank you for letting me talk so fast. I could see the questions popping up in the chat. Cynthia, do we have time for a little bit more?
Yeah, if people are willing to stay on, and I can ask a couple, or I don't know if you, I have a few just ready to go here. Bill, thank you so much for all that information. I know people have tons of questions here. I'm going to try to culminate a few of them. A lot of people have questions about working with the private market, and especially in these very tight housing markets where there's less than 1% of vacancy, like here in San Francisco and in many other communities, even small ones in New England, all over the country. How do you work with private markets, private landlords to, one, secure units when they can talk to anybody in the market and get more, potentially? Two, how do you reduce the barriers that people that we are serving may have, criminal justice involvement, eviction histories, maybe no rental history? How do you engage landlords in a way to reduce those barriers? Are you actively trying to advocate to reduce barriers? Are you incentivizing landlords? What are the strategies that you're using?
It's mostly, I would say, on the incentive / risk assurance side of things, rather than trying to sort of persuade them that it's the right thing to do from a moral lens, right? And so in those tight housing markets, there's no question that that's where the staffing model as well as the financial resources are super critical, right? There are times when it just is going to take longer to find the number of units you're looking for. Sometimes we're able to be flexible around where we find the units. We have helped people relocate out of San Francisco, although our goal is to make sure that people stay in the community that they want to be in. That's always voluntary, but if you can bake in the flexibility to be securing housing resources in communities adjacent to the one where you're being funded, then that can help as well. We also, for example, and this, I don't know if there's any way this could work, say, with emergency housing vouchers, but where we're using flexible local subsidies, we target toward FMRs, but we can go above for any given unit. And we do that in discussion with our funding partners. Now, I know that the housing authority rules tend to prohibit anything like that, right? But having those types of flexibilities can also be critical. And around the criminal justice piece, I think our teams have been quite remarkably successful, right? Like, we can be flexible. There are landlords who, once we enter into our agreement, and we call it a rent subsidy agreement, or we have a more beefy one that we call a master rent subsidy agreement. And that's all the terms and conditions, all the promises we're making to them in order to secure that unit and retain control. Most landlords will then say, okay, this is your unit, we're gonna look the other way. Some landlords, certainly a percentage of landlords, still want to, screen tenants. But we're able to get landlords, not to use their normally quite rigid screening criteria, and we're able to successfully house people who are exiting the justice system.
Yeah, and I think that what you were saying about having all pieces of the model being really critical, so that really that landlord engagement piece is responding to all of the risks that landlords are worried about, which is really business model risks for the most part. And wanting to make sure that there's not a day in there that's an empty day in one of their units. And if you have a pipeline, that you have this relationship with landlords that you can sort of continue to stream and they build trust with you.
And let's talk about that. There's not a day. So it's not just that we're saying, hey, we're going to pay you to take this unit off market. It might take us a couple months to fill it. If for some reason that program participant moves on, we will pay to turn over that unit, right? We will hold that unit, and if it's vacant again for a month or two, we hope it's shorter than that, the landlord has zero vacancy. Even in a hot rental market, that's not usually possible. So, it really does take developing a certain type of mastery of a local rental housing market and beginning to cultivate those relationships. In the communities that we've been working in, even though they're very expensive, Cynthia, maybe we have had some good fortune in that they're diverse, right? There are neighborhoods across San Francisco, there are neighborhoods across LA County. We do try to avoid over concentrating all of our units in lower income census tracts. So that's a really key driver for us. There are some neighborhoods that are simply so expensive, we're never gonna be able to buy into them.
Thank you, Bill. And I thought maybe I could hand it over to you if you had questions or you wanted to wrap us up or whatever you think we have time for.
Yeah,
Thank
I think we can go 5 more minutes. I want to thank you all for sticking with us. I know we still have a little over 280 people with us who are really interested here. And folks are like sharing documents in the chat, which is just brilliant. I have 2 questions that keep coming up in the Q&A and in the chat. And the first is about housing quality, Bill. How are you, this issue of like problematic landlords or landlords that aren't fixing up their units or who are considered slumlords, like how do you weed them out or how do you address those issues if they come up after somebody's already in the unit?
That's a great question. Where we're working with local flexible subsidies, as opposed to working with any type of Section 8 or federal subsidy, we've modeled housing quality standards on HUD standards, often with an additional layer, really coming out of the public health lens, right? That we know we're serving vulnerable populations. So we always have those housing quality standards in place, both on the front end, before we take down a unit, before it's ready for move-in, and then ongoing. Problems do arise, right? You do have landlords that aren't maintaining their building or aren't responsive to something that's happening inside a tenant's unit or in a common area. We do try to, avoid going legal. There are times, and where I do think our teams deploy flexible funds to help a landlord, where, and those are judgment calls, right? Like there are landlords that we may simply at some point have to decide we don't want to work with. And I shared with you, and this was sort of something that had just bubbled up internally at Brilliant Corners, and I knew that there were tensions between one of our housing, landlord engagement teams and our tenancy support teams, and it was precisely about this: the quality of the units in a particular landlord's portfolio or that landlord's attitude. When does it rise to the level to say, you know what, we're desperate for units, but not those units, and there's no sort of way through incentives and customer service or even deploying financial tools to work around that and make it better. I think for us, what's key, we're never going to say, hey, here's units to our case management partners and our clients and say, take it or leave it. These are bad units. We wouldn't want to live there, but this is all you get. So we bring that client-centered mindset and values, and we memorialize that in the documents that we sign with landlords, as well as in our housing quality checklists.
Yeah. And you also touched on, I've seen a few times, and I know you touched on it based on one of the questions that Cynthia asked, like a risk mitigation fund and how that gets used or operationalized. Lots of communities are starting to partner with local foundations or banks or whatnot to set up those funds. How does that work?
So, I said that wherever possible, even if you don't know how you're going to get it, I certainly think that it's worth line iteming out all of the different financial resources you would need and having a dedicated line item. And damage mitigation funds or risk mitigation fund for landlords is one of them. You can also have a fund for unit modifications that really isn't about tenant cost damage, but you just need to do some unit mods. Maybe it's more than the property provider is going to be ready and willing to do, because they have choices and they can rent as is. So line iteming those things out, I think it's really important as a risk assurance tool. Staff after listening into this call will tease me about all the things that I misstated and got wrong, and I hope this is not one of them. But I think our experience has been that those funds have typically been underspent. It's a little bit like when we're building buildings And here in California, the California Housing Finance Agency wants you to put $5 billion into a long-term operating reserve that just sits there because they're afraid Section 8 will disappear in 10 years. I'm being facetious, but it's more about assurance. And then it's utilized once in a while, but we've typically not drawn down all those funds on an annual basis when you see six-figure line item at scale for damage mitigation. I think another nice thing to sort of, I don't have a RAND report that tells me this, but anecdotally, it just strikes me that what we learned there is that all these folks that so many people in our society think don't want to be housed and aren't ready to be housed are not destroying their units when they move in because it's their home.
That's right. Yeah. I think we're going to end on that point. That was a really important point to make because that is a myth, certainly in my experience.
Yeah, mine too.
Yeah. We might need to have you back to just do an open Q&A because we have so much interest in this topic. And obviously, Bill and Cynthia, you sort of opened up a box of things that folks are really struggling with and working through, and you have so much experience in this area. So we'll have to talk about that offline. Richard sends his regards. He had to log off. He had a hard stop, so he wants to thank everybody for being here. He wants to thank you both. He wants you to know that he loves y'all at Brilliant Corners, and thank you both for your work and your presentation today. Just a reminder to everybody that this presentation will be posted on the website. Kim has put the link in the chat a couple of times, so please feel free to view it or share it with others. And thank you all for being with us today. This was such a great conversation.
Thank you so much. And thank you, Bill.
Oh, thank you. And thank you, Cynthia. You're too generous and too kind. Thank you, everybody, for the very interesting questions. I'm available. Both can reach me. I'd be happy to share information and documents.
Great. All right.
Bye-bye, everybody.